Hi, I'm Dr. Jeffrey Marino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Bellissimo Live. Today I want to talk about our Helix laser. I've been kind of promoting it a little bit, but we've been using it now since June. Angie is with me today. Angie also treats patients as well as our PA Amanda, but Angie is also the patient on the other side of this as well. So we want to talk about that, and I want her to share her experience with you. But this device is really amazing. So you've heard me talk about in the past our CO2 laser that we use, what was called a cool peel. It's really one of a kind. The company is Deca. It's an Italian company. They're at the forefront of laser manufacturing and well known in the industry. We have been using their CO2 laser for at least 5 or 6 years. This company is so amazing, they have now added to that laser. So this device is Helix. It is the combination of that Tetra CO2 laser, which is on the upper screen. And for the first time ever, they have fused this CO2 laser with another laser. So the second laser is a 1570 nanometer wavelength. So patients, you might not be familiar with that, but we remember the partially ablative lasers from a few years ago. Fractional is one of those. There were other lasers out, but those, just by the trade name, you might remember that. The problem with that is with the 1570, it was painful. The technology wasn't there yet. The results were pretty decent, but it was really uncomfortable and patients didn't tolerate it very well. But now with the new technology, the benefit of the 1570 laser is that it goes a little bit deeper than the CO2 capabilities, and it can cause more heat in the dermis, in that collagen wave of tissue in the dermis, and it causes a little bit of shrink wrapping. So the amazing thing about this is that we have a little bit of downtime with the CO2 laser, depending upon the settings for that. We also have some downtime of the 1570 laser. But the part about it that's amazing, now that they have fused them, and nobody else has been able to do this yet, the fusion of those two, the downtime is less. So patients now, we can treat at a much higher level of energy for the CO2. And when we add the 1570 treatment to it, their downtime is, instead of 7 days, you're now down to 2 or 3 or 4 days of redness. And heat equals results. So the more that we can heat up your tissue, the more results you're going to get. So it's been an amazing change. So not only do they fuse it, but in the same microbeam, and I don't know if we can show this, but in the same red microbeam, that when we fire it, you can see it spray, and we can maybe trying to do that later. But when it sprays, those beams are a actual fusion or combination of those two lasers firing at the same time. Right now, I have this laser set that the CO2 beam comes down, and right behind it is the 1570 beam, which drives it in a little bit deeper. We can actually set it so they're side by side. We can change the amount of CO2, like proportion to the 1570. So the Italian engineers of this device have made it so versatile that we can change the settings depending upon what we're going after. If we're going in for a little bit more tissue tightening, we might add more 1570. If we want to go after more lines, rhytids, and texture, then we would add more of the CO2. And there are different settings of the CO2. There's high pulse, smart pulse, and decapulse. In the past, the decapulse is really that setting that we want to use to go after those rhytids and those lines and the texture, but it was more downtime. But now with this, we can go to that Deca setting, that Deca power setting, and with this fused together, somebody that would have 7, 8, 9 days of some redness and swelling is now down to about 3 or 4 days. The difference is also in the time frame of the last few years. Our pre-op and our pre-treatment and post-treatment regimen is a little bit different, and now we brought in something called exosomes, which has been a hot topic for about a year. The company that we're using really uses a specific way of harvesting and growing these exosomes. Basically what they do, exosomes are usually used for cellular communication and to treat inflammation. So using this serum immediately post-treatment really kind of calms that redness, so your swelling and your downtime is even less. So without saying too much, kind of giving that intro, I wanted to bring Angie in because I want her to talk about her experience. And we did use the exosomes, but yeah. So from a pre-treatment standpoint, Angie had some texture issues, some sun damage, but she also has some freckling that is just sort of natural to her skin.
lot of freckling.
Right. So we didn't do any pre-treatment like up to the time of the treatment, but during the treatment we used a numbing cream for about 20 minutes and then started with the settings. So the settings for her, what we would consider pretty moderate settings, but much higher than what I was using with just the CO2 laser from just up until 6 months ago. So tell us, how numb were you? What was it like?
So from the beginning, full disclosure, I'm almost 46, so I should start there. A lot of people have asked me, why would you even do this? What's so great about it? So yes, fine lines, some texture. Obviously, I'm one big freckle, so I wanted to calm all of that down and hopefully maybe look a little younger, we're hoping. So the process itself was really amazing. I can honestly say that I love this laser to run it, but as a patient, it's always different when you're a patient. What do I expect? What do I do? So as Dr. Antamino said, we cleanse the face very well, and then we add a numbing medication on top. So that was about 20 minutes. You don't feel anything as it's numbing. There's no heat, there's no tingling, but you do notice you kind of feel a little bit more plump. The face feels like a little full. Once that was cleansed again, we started the process. With the process, you do have eye shields on, so we can either do some music in the background. For me, I kind of did a little guided imagery. Everybody's different what they like, but your eyes are covered to protect because of the laser. The process itself, I numbed for 20 minutes, and it took about 20 to 30 minutes for the laser. I did my full face, and I did right to here on my neck, so it took a little longer if you would just do face. So people say, what did it feel like? Honestly. And it feels like little, I would say bee stings, kind of warm at times. We use a cooling machine, a Sub-Z. So as this cooling pad right here touches your face, this part is cool. So the laser's here, this cools. So it's two things that are cooling the treated area. So it was comfortable. And a lot of people say, I think you had mentioned it's more aggressive, but there's less downtime. So I'm not gonna lie, I was a little skeptical. I was, but it really did work. It was amazing. So the process itself, we're looking at 40 minutes. Afterward, I had a thin layer of Vaseline placed, but then the warmth started. So I can honestly say 1 hour feeling like I had a sunburn. My face was red. I did take photos every day to document. After the 1 hour, it was almost like I flipped a switch. It was not uncomfortable. I slept fine that night. I didn't have any, I had some swelling through the mouth area, which is common, very normal. Some swelling through here, all normal. So I was waiting and waiting and waiting, and I had no other pain. So that 1 hour was just that really intense sunburn. I drove home with the air conditioner on. I can't say it was anything terrible. And then the next morning I got to wash my face with a gentle cleanser, and then I reapplied some moisturizer, which we provided some very good instruction. But then day to day. So first day I did have some swelling, which was I expected. No peeling, but I started to feel like sandpaper. So my freckles hit a lot of it, but you can see these teeny tiny little micro scabs that really resemble sandpaper. The next day, I started to exfoliate right through here, and it was baby skin. So it was just the hardest part was not exfoliating. So we don't want you to exfoliate anything off of the face. You want to let it fall off and soft as it naturally would with gentle cleanser. By day 5, I had only just a small amount right here of sandpaper left, and I never ever had pain after that 1 hour. So I'm ecstatic. I think my skin looks much better. It looks clearer. It looks more firm to me. I'm really excited not to have all the extra pigment that we know I had beforehand. So if anyone's seen me in the office, everyone thought I had a little bit of sun, which I try to avoid. So going back to work, people have asked, are you in pain? Like, what are people asking you at work? In this setting, obviously it's welcome, but in the average setting, a lot of people that are doing hybrids, like Zoom calls and things like that, we didn't use makeup. We would ask you not to use makeup, but I truly didn't feel like I needed to. So at this point, I'm doing our skincare here. I'm using our not foundation, which is so nice because when people ask me, do you use foundation? And I can say no now. Tinted moisturizer is it. So my process was great. I would do it again in a heartbeat. I don't think I need another one, to be honest, right now, but it was nice to be able to go through the process on the other side as a patient.
Right. And so the whole process, like you said, it feels kind of like this tingling sensation. We also have our Sub-Z, which blows cold air, and we're doing that as the laser's being treated. And then you came to work the next day.
Oh yeah, I was here the next day.
And so
no issues.
There was no downtime. And then as far as that, but the amazing thing is, in the past, when we used just the straight CO2 to do this kind of setting, you would have been gone for a week. It would have been some scabbing, not only open wounds, but it would have been a lot more swelling and just a lot more downtime. But the amazing thing is when you put these two together, and again, there's no other device in the world that does this. So these engineers at this Italian company are phenomenal. This device has been great for us. So we not only use it for the face, we use it under the neck, on the neck, down into the décolleté area. We can use the back of the hands. It really can go anywhere. It really is such a good rejuvenator. So in the past, we would have had to treat patients 2 and 3 and 4 times about a month to 6 weeks apart to get now what we're doing in one visit. And so for that standpoint, the patients are much happier. We can do everything and shrink it down into 4 days. So I usually do it when I'm treating patients. I usually do them on Fridays on the Fridays I'm in the office. Amanda and Angie do it through the week. So in all honesty, we've not had any problems with patients healing. So, and again, now with the use of these exosomes, which are sort of brand new to us and really haven't been on the market for about a year, it also it calms the inflammation, getting you back to your lifestyle as quickly as possible. But the amazing thing is the changes, and we are at 3 weeks now, the changes without, we did it after work on a Wednesday. We were back to work on Thursday morning, Friday, the weekend off, and then back again for a full week on Monday. So the amazing thing is there's really not very little to no downtime with this and treating things aggressively. And at 3 weeks, your skin is amazing. The color blend is there. It's very homogeneous, so there's not a lot of different colors. So you don't need a lot of makeup. You just really need hydration and moisturizers to your skin, and that's about it. So a huge change in our aesthetic, devices and our aesthetic center. Cartessa is the company that distributes it. When we started finding out about this about a year ago, the owner and I were talking, and he said, you're going to want to trade out your CO2 for this one. And he knows how much I love that CO2 laser. So it's exactly the same laser, but now it is just so much better because of the 1570. So we love it here.
Speaking of devices, not to cut you off, but other devices we can couple this with are Virtue RF. So I've had the very, very great pleasure of treating a few patients so far with acne scarring. And historically, microneedling was our option for scarring, which it still is with the CO2.
Right.
But when we couple it with the Helix, we're getting even better results and less downtime. So, excuse me, boxcar, rolling acne scars. There's so many different types. Ice pick scarring. Years ago, it was that you just have to live with it. And we have come so far, and our patients are very happy with that. Just the confidence comes back. Their ability to be on camera with working hybrid, which is so common now. We've had a really great success rate with that. And then also too is, acne scarring isn't just cheeks, to use it on the back, to shoulders, things like that. So very versatile. So when we think of devices, this is amazing, but we can couple it even with Exact RF, Exact under the eye, around the mouth. So I look forward to what else we can do with it.
And as you brought up, is the nice thing is you can use it with other lasers or devices simultaneously. So in the past, we've had to treat with one device, and you'd have to go somewhere else to get a different device or a different laser to treat something else. And now with our chrome laser, which which Angie does as well, treating little spider veins, telangiectasias, color, melasma, pigments in the skin. We can do that at the same time. So it's not uncommon for a patient to come in and in 1 hour and a half to 2 hour setting, treat under the eyes, treat some rhytids here with the microneedling radiofrequency, the chrome laser, the helix laser, all at one time, same kind of downtime. So that's the amazing thing about this is now a lot of our devices in the aesthetic center are now used in fusion and in combination with each other to really treat things that we were not able to treat as of just even a couple of years ago. So the aesthetic world has really blossomed with these devices. And we've spent the last 3 years really collecting the best of the best to treat a lot of the problems that patients come in. So now at our aesthetic center, just about every patient that walks through the door, we have some type of solution for. So anyway, we wanted to bring this to you. We're so excited about this device. It is really an amazing addition to our aesthetic center. So thank you to Angie for showing everything that we've done and also talking about the process. If you have any other questions, feel free to follow us on our website, social media, and we'll look forward to seeing you next time.